I definitely think better staff has a lot to do with it. I just have hygienists now that are very comfortable talking to patients about things that they see in their mouth, like
a staff member coming to you and just saying, "Hey, just give me a second to finish this up." That's a perfect example of not allowing yourself to be pulled away, being present, and then being able to transition. There's so many people that would just like keep typing and keep trying to listen at the same time. Welcome back, everyone, to another exciting episode of the Lifestyle Practice Podcast. You've got myself, Dr. Derek Williams, here, along with one of my favorite guests, Dr. Danielle Guerrino. How you doing, Danielle?
Good. How are you doing?
Good. So this is our third episode in this series. The first two episodes were recorded during a period before we had video, before that was part of our podcast. So this is the first one where you're showing your face. So thanks for being willing to do that. It's always a little bit intimidating.
Yeah.
So today is April 27th. So at this point, we are about 6 months into your journey, and I really appreciate you being willing to do this. I've never had a guest on the podcast that has been a client that's been willing to give an inside look to the experience all along the way. And I kind of threw out that idea to you at the very beginning, just knowing that I felt like you are someone that is able to be authentic, and you know kind of your strengths and your weaknesses. So I'm really glad that we've been able to do that, and I'm really appreciative that you're willing to continue to do that over time. So thank you.
Yeah, I'm happy to help. Happy to share my journey with everyone, and everyone.
Yeah, thank you. Let's jump into things. So we had our first episode, and again, for listeners, remember, like, you're listening to these kind of back to back, but for Danielle and I recording them, there's several months of time in between each one of these episodes. So the first episode is in the very beginning. What's it like? The last episode was, a few months in, starting to kind of work through some things, get a handle on some things. And now we're about 6 months in, and we've seen some really cool progress in some areas. Still, definitely several challenges. And so I'm excited to kind of talk through that. But if we can start off, give our listeners kind of an inside look. Tell us a little bit about, like, where is your headspace right now? How are you feeling overall about your journey into ownership, your expectations and where you're at? Just how are you feeling about things in general right now?
Things are really good. There are definitely stressful times, but I'm really happy about the journey so far, and I think we're really successful. I definitely, if you told me 6 months ago that we would be here, like, production wise, I probably wouldn't have believed you, but so I'm really happy about that for sure. But yeah, it does come with a lot of stresses, but it's worth it. I definitely don't regret any of this. I want to be clear about that. But, being a mom of two young kids, I have a 2.5-year-old and a 1-year-old. It can be kind of a lot, but it's definitely awesome. I don't miss being an associate, like, at all. Just seeing, like, where we are at now, I definitely, like, wish I wasn't an associate. I know I've said this before for so long, like, that's one of my bigger, like, regrets in a way. I wish I definitely started this prior to having kids and wasn't an associate for so long, but we're here now, and I'm definitely happy of where we're at. So
okay, so you say it's worth it. I don't regret my decision as far as going into ownership. Talk through that a little bit more. What are the, like, kind of the background thoughts that are leading you to that point? What are the hardships and things that kind of make you feel like, oh man, this is such a grind? And then what are the other thoughts that help you to recognize that it is worth it, and it is what you want to be doing?
I would say just lately, I'm in Florida and we have a lot of seasonal patients. And so I'm pretty familiar that, you know, December, January, February, March is really like the busier months, which is great, but you're juggling like a really busy schedule. And so trying to juggle that and also just like staff issues, just, you know, little drama and chats that you have to have, and just managing the people in your practice, and also trying to see and manage the patients, and also just trying to manage home life. It can be a little overwhelming. So I would say that's the biggest stress. So yeah, just trying to juggle all of that can be
Yeah,
challenging.
yeah, it's a lot of hats to wear. It's
Yes,
it
it's a lot
totally.
of
I felt the same way in the beginning. For me, in the beginning in ownership, it wasn't that any one thing. Well, for me, because I was right out of school, probably the clinical part was still probably the most
oh yeah,
stressful part for me. Like
yeah,
even doing a crown prep and figuring out
yeah,
how to make things work. But the difficulty was exactly what you're talking about. It's almost like you can never quite take a break a little bit. And I haven't been an associate, but I've definitely been an employee before
right.
of different companies. And when you go take a break, you really can take a break. And when you're an owner, it's not exactly the same, because
Hmm.
you go take a break and there's other things that you have to do. There's other things that kind of have been in the back of your mind that have been
Right.
like, oh yeah, you really need
Yeah.
to be doing this. You need to be thinking
Yeah.
about it. So then when you go sit down and you take a break, that stuff comes to the surface, and that stuff can kind of carry through into other areas of life as well.
Yeah, it's tough. I mean, just, there are nights where I don't sleep much because the kids are sick or they're just having a hard time sleeping. And so it's tough to go into work on, not like a full night's sleep and having to be on all day. I feel like that's the hardest part, just especially now because I'm starting to see the patients second time around for their 6 month recalls, but I'm still meeting a bunch of new people and just having to like be on all day, and just try to be in a good mood when you're like on no sleep and worrying about your kids being sick and things like that. It's tough. And then just, things with staff happen and you have to have talk to them about this, and just, yeah, all of those hats can be a lot. But again, I don't regret it. It's just trying to manage all of that is a lot.
Yeah,
So
yeah. I'm curious. I haven't I haven't followed up with you on this. I'm curious. So one thing that we have talked about in the past in a coaching call is trying to compartmentalize your thoughts in a way, as far as mindfulness and really being present. That a lot of
mhm,
times, like I talked about, there's those things kind of going that are on the back burner in the back of our mind, and that kind of carries over into a lot of different areas in life. We go home and we want to be with our kids, with our spouse, with whoever, and we find that stuff kind of creeping in. Have
mhm.
you found any success in being able to be more present, or things that you feel like have helped you in that regard?
I'm definitely trying to be like more cognizant of being in the moment and not thinking. So the biggest thing for me has been turning off work and just coming home and spending time with the kids and my husband and not thinking about work. And it's just so easy for me to just, oh, I forgot to follow up with this patient. Let me put a quick reminder in my phone. Or I have to ask my front desk about this patient or this case. I just like have to fight the urge because I have such a bad memory that I usually have to put everything in my phone like right away. And so I'm trying to fight the urge to just put my phone away and just focus on enjoying the kids and my family. So it's been better. I've been better. I'm not perfect, but I just have been trying to just go put my phone on my charger in my bedroom and just come hang out with the kids. And then once they're in bed, then I'll try to get a little more work done and do what I need to do. But then I'm trying to spend time with my husband, and he gets upset when I'm on my phone. So we like have been watching shows together, and that's been like our time together after the kids go to bed. So it's been tough to juggle it all, but I'm working on it. And even at work, it's hard when you're doing something on the computer. I'm like trying to type a note, and then like you know, my hygienist is coming to talk to me about another patient, and I just have to be, you were like, just ask
Yeah.
them just 1 minute. Let me just finish what I'm working on for just a few more seconds, and then I'll talk to you. So I've been trying to just like kindly just tell them, hey, I'll be with you in just a second. Like, let me just get this thought down. And then, so that's helped.